When you think about the knee joint, it's really nothing more than a simple hinge joint, right? It's meant to move back and forth. It's not really meant to move side to side. On your operative leg, I want to see if you can do a single leg hop. So if you're moving from side to side, for example, if you're making a cut on a football field as a running back, or you're coming out of your break as a wide receiver, or you're changing directions to make a stop as a goalie playing soccer. Those are the typical type of activities where ACL injuries occur because the ACL is vulnerable for those types of sports.
The research that we've done has resulted in kind of a branding of Rush as a major center for knee ligament surgery. And 5 of the 9 of us who do knee ligament surgery do somewhere between 600 and 700 ACL reconstructions annually. Pretty big footprint that we have on ACL treatment here in the Chicagoland area. Just checking how your kneecap is moving from side to side.
If you just look at the female athlete, there are certain dynamic and strength deficits that the female athlete has in general. So that could be hip and core weakness, gluteus medius. It can be strength deficits between the quad and the hamstrings.
I think the screenings are important because if we can prevent injuries, that's better for the athlete. You know, an ounce of prevention is better than a pound of cure. And I think that if you're an athlete and you can stay on the playing field, that's definitely the way to go.
Certainly the thing that we do best at is teaching, coaching, and risk prevention. And that's on physical conditioning, technique, how girls land, how they jump, how they train. Those are things that we can help educate on to lower that risk.
Go ahead and start whenever you're ready.
Okay.
We examine their knee. The physical exam is extremely important, but there are some other dynamic issues that led to the ACL tear in the first place, and we're now keying in on ACL prevention as much as return to sport. There's no question that it has value to us as physicians, and frankly, this could be for any patient who's undergone an ACL reconstruction.
There's no way we can make the risk zero. That's just, unfortunately, the only way is not to play sports, and that's not a viable answer for most of these patients. But whatever we can do to modify risk, I think patients and parents alike would like to do that to try to make them successful at sports.